Hi, hello, welcome. Sheehan here, that's what she said. Coming to you now today on Tuesday, March 18th, to give you an update following my second chemo treatment and just let you know what my experience has been in the past. It's been 10 days now since my second chemo infusion, and I just wanted to come to you and talk to you about what my experience has been, because I did start to have my hair all fall out during this infusion. And for those of you who have been following my progress, what I did was I first cut my hair and donated it to Wigs for Kids, and then I got a buzz cut, and then a week later I got an even closer buzz cut, all in preparation for my hair falling out. And honestly, I think by doing those incremental steps, it got me used to what I'm going to be looking like with shorter hair. But there is, one tip that I wanted to talk to you about, and that is that if I could do it all over again, I would definitely have cut it short, but I would not have buzzed it as short. And the reason being is that as my hair was falling out, it didn't all fall out in one piece. It was just shedding constantly, and those little pieces that were short were really aggravating and itchy. So if I had to do it all over again, I would have left myself where my hair was probably about that long, because the longer pieces didn't itch as much as it fell out, and it just, the spot that was really closely shaved in the back of my head, with the heat and the fire from the chemo, it was irritating my head as it rubbed on the pillow. One thing that really helped with that was my mom's suggestion of using a silk pillowcase, and that certainly helped, but it definitely didn't take away the discomfort. And it's almost like having a heat rash, and then these short hairs rubbing against the pillow was just really tormenting, actually. And I'll let you know, as much as I was prepared to having my hair fall out, nothing prepares you for having your hair fall out. It does not come out all in one piece. It comes out in random clumps. And psychologically speaking, it was a really hard week for me to get through because of that. I was experiencing heat, pain, discomfort, nausea from the chemo, and then just having my hair falling out and feeling like I looked like a crazy person, for lack of a better term, because it was just random patches everywhere. One thing it did positively was it gave me a new level of empathy for men who have their hair fall out at a young age, and also for people who deal with alopecia and just any type of hair loss. I really feel you on a whole nother level now in terms of the psychological effects. And I just, my heart is with you and my prayers are with you. And without further ado, I want to do my bald reveal so you guys can all see. Like I told you, everything was all clumpy and basically all of my hair fell out other than random pieces. So last night my cousin Kayleen did shave my head, and now I feel more confident with the baldness because it's even and it's just completely bald. And for those of you who are just watching this video, my cousin Kayleen and I just did a makeover party because I felt like it would be fun to have a little bit of makeup on and just show you the confidence that you can have being bald. Bald is beautiful. So without further ado, here's the new she, bald as a mofo. But I'm actually loving it, no lie. Look, here's what I look like all the way around. Bald head in the back. I have a mole. And it's interesting to see what I look like bald. What's also interesting, I don't know if I can show this because the light, you can see up here, there's a scar on my head from when I was 2 years old. I ran into something and had to have stitches in my head. And it's funny because I've never seen that scar before. But here I am, and I'm looking better, and I'm feeling better, and now I will be having my 3rd chemo treatment this Thursday. So today is Tuesday. I'm going to be seeing one of my physicians today, and then I'll be going to see Dr. Mehta, my breast oncologist, prior to chemo. Now, really good news that I want to give you is that the last time I went in for my infusions, my blood work had come back wonderful. I was sometimes 3 or 4 times at the level of what my physician typically sees patients at. And he just was amazed by the vitality and really gave me positive feedback in terms of how I'm handling the chemo. So that's some really good news. That being said, it is, you know, a little bit of a compounding effect, and I am definitely nervous about this Thursday. Again, I was hoping that I would have more good days this time. I mean, typically, I'm only getting 4 good days after my treatments and between cycles. And this is really concerning me because I really want to get back to work. However, I'm not sure how I'm going to resolve getting back to work and having, you know, 7 or 8 days of downtime. I'm not sure how I'm going to integrate that, but it is on my mind, and it is something that I'm looking forward to because I know getting back to work will help me. However, I need to give my body the appropriate rest, nutrients, before doing so. So I'm going to be having that conversation with my physician this week, and as well as my boss, who's so supportive, Patrick McCoy. I love you, Patrick. And, you know, we'll just take it one day at a time, one foot in front of the other. That is the advice that I had gotten from a fellow patient who was receiving chemo treatment last time with me. Before she gave me this beautiful bracelet of solidarity, she told me, "You're going to make it, honey, and you're going to do it one day at a time, one foot in front of the other." And I just think that that is such a beautiful approach for any obstacles that we're facing. And yeah, so I think that's pretty much all to update you for now. I also want to let you know that I did reach out to a fellow cancer patient who also has lost her hair, and when I was really going through the mourning process of what I was looking like and changing, she really helped motivate me in terms of like different head wraps and things that I can use. But I'll be honest with you, I think I'm going to be rocking the bald head a lot because I kind of like it. And I feel like the caps, I've been referring to them as cancer caps because you look like you have cancer anyway. So I feel less sick, just bald-headed than I do with the cancer caps on. And that's the last thing that I wanted to tell you about the hair loss is it really isn't the vanity of losing my hair personally. What it is the messed up part and the fearful part and the anxiety of it was all around the fact that the external, like, validation of my illness. So I felt like now I can't hide. Like with my hair, you couldn't really tell I was sick even after my mastectomy. Other than the weight loss, you couldn't tell that I had cancer. That's the beauty of having immediate reconstruction. But now that I've lost all my hair, there's no hiding it. And that is what was so emotionally hard for me, was just feeling like I looked sick. And then from looking sick, I started feeling like I looked crazy. And then from there, I started feeling like I was looking like an old man. And I just... Again, my heart goes out for anyone with alopecia or early hair loss or also going through these chemo treatments. I want you to know that you don't need makeup. I just did this for fun and for my reveal. I'll come to you in the future, you know, bald-headed and no makeup, just to show you what that looks like as well. There's no shame in my game, and you know, I understand people who have issues with the vanity aspects of it, and there's no shame to you either. I did find, this is interesting, at my last treatment that there's a hair salon in New Jersey that is going to do, a hairstylist who owns the salon, going to give me a wig for free. So that's kind of fun and exciting. To add that into the mix too, for when I really want to just go out and not feel like anyone can really tell what's wrong with me. That'll be fun to experiment with from time to time. And lastly, as you can see, I have not lost my eyebrows or my eyelashes yet. I pray to God they stay in, but there's a good chance during my next session that they will go as well. And, you know, that's just going to be another stage of evolution and change and transformation in my body that I know is temporary. And I just have to get through for the time being. I know I am not a body. I am free. I am still as God created me. I am... still learning so much from this journey and actually trying to find all the blessings and gifts that come out of it, such as having my cousin Kayleen and my Aunt Barb and my cousin Stacy coming to visit me this week. It was really wonderful, as well as my friend Beatrice, who drove 3 hours from Queens to bring me some vials of nature that everyone from Columbia University Hospital, where I worked for 10 years, made me these personal vials where they went into nature or somewhere in their home and brought a little message and a piece of nature to me. So thank you, Beatrice, and thank you everyone from Columbia. I miss you and I love you. I want you to see I'm doing strong, I'm doing good, my port's looking good. I guess the very last piece to update you on would be the fact that I did get my 4th fill last Thursday with Dr. Fahey, and try and show you what that looks like without revealing too much. See, it's not really that big from the side, but from the front, it's stretched a little bit more than I'm used to, and I did have a lot of pain with this last expansion, which, if you know from my previous expansions, it wasn't hurting me at all, but for some reason, this past one just completely felt like it ripped the muscle from my sternum. And so I did have a few extra days of pain based off of that hopefully I won't be having next time. But I think that's all for now. I want to thank you all for your continued love, prayers, and support, for all of you in my family who keep coming over and helping feed me and take care of me, and my brother juicing for me, and everyone giving me rides, my father, my best friend Rachel, my grandmother. Thank you all for rallying around me. Your love, support, and prayers cannot be underestimated. I thank God for you every day, and I pray for you and for anyone going out there through this similar struggle. My heart and prayers are with you as well, and I look forward to seeing you during my next update. That's what she said. Mwah.